In this morning's Health Watch, a leading group of doctors is publicly breaking from CDC vaccine guidelines for kids. The American Academy of Pediatrics now says it still wants all children to have routine immunizations for 18 diseases. Health Secretary Robert F. Kennedy Jr. recently cut that list to 11 diseases. CBS News medical contributor Dr. Celine Gounder is editor-at-large for public health at KFF Health News and joins us now. Good morning.
Good morning.
All right, so how does the American Academy of Pediatrics recommendations differ from what the federal vaccine guidelines are?
Right, and I want to emphasize this is unprecedented for the AAP and the CDC to diverge. They have been working in concert for decades. The new AAP vaccine guidance is basically the old CDC vaccine guidance. So the guidance that we had, the recommendations we had prior to the Trump administration and Secretary Kennedy running things at HHS and CDC. Now, also, you have 12 different medical professional societies that have endorsed the AAP recommendations. So that includes the AMA, Infectious Diseases Society of America, obstetricians and gynecologists, and more. So this really shows that there's broad consensus within the medical community behind this.
So it sounds like the AAP is out of step. So why are they doing it?
The AAP or the CDC is out of step? So the
CDC.
Yeah, the CDC, I would say, is out of step. The AAP is doing this because they feel and believe that the procedures, the process for coming up with these vaccine recommendations has changed dramatically under this current administration. It was very consistent for decades, again, under both Republican and Democratic administrations, but unfortunately has been politicized in a way that they feel it's no longer trustworthy.
But now doctors normally follow the federal vaccine guidelines. So what does it mean? And what's your advice to parents who are trying to think, what do we do here? Who do we believe?
Well, it used to be they were the same guidance, right? You didn't have to pick and choose. And I think now, frankly, my advice would be to follow the medical professional societies. You know, they're the ones that are taking care of the patients, who are seeing the kids on the front lines. That is their interest. And by the way, pediatricians are among the lowest paid doctors out there. You don't make a lot of money giving vaccines.
I didn't know that.
Yeah, so, you know, this is not about money. This is actually about doing the right thing by their patients. In terms of what parents should do, talk to your pediatrician, ask them which regimen, which recommendations they're going to be following. The specific ones to hone in on are flu, COVID, RSV, and then hepatitis A and B.
Yeah, but your pediatrician is the one that has the day-to-day or the contact with your child. I would think that they would carry more weight. Dr. Celine Gounder, very good to have you here, as always.